Woburn. I'm your host, Samantha Stone. And as we've been doing, we have some wonderful leaders to join us today to talk a lot about what's happening and how we're responding to the global health crisis and what that means right here in Woburn. Today, I have Mayor Scott Galvin with me. I have Representative Rich Haggerty. And a new guest for this format, we have Representative Michelle Ciccolo, who's also joining us. And we're going to talk to them about some of the things that have been happening over the last few days since we last connected. And I also have some questions that you guys have asked me as follow-up to the last episode that we did. So we'll dig into those as much as possible. Welcome, everyone.
Welcome.
Scott, I thought we'd start questions with you today, if that's okay. I thought we would begin by just getting a quick update about where we're at in terms of positive tests, people who have recovered. I believe there was maybe, unfortunately, a couple more deaths this weekend, and wanted to just get a feel for you where we are.
One of the things, Samantha, we have an excellent website that we update daily, and I think you're familiar with it.
Yes.
It's woburnmass.gov, and we have a special section for the COVID-19 cases, which again we update every day. And I just got off the phone with the Board of Health and Marie, my assistant, and I think up to date right now, since the start we have 116 total cases, COVID-19 cases. 67, which is good news, have come out of isolation, who have basically cured, and 49 are still in isolation with symptoms of COVID-19. And as you mentioned, the most unfortunate thing is we've had 4 deaths from it, which has been very tough for the city in that case. And it never makes it easy when you talk about the deaths, because they're people who are really held in high esteem in their family, and generally in our case we've seen them as they've been older, with somewhat underlying health issues, which again doesn't make it easy, but that's what we've seen in the city. But again, the incidence of the COVID-19 has spread almost equally across all age groups, and we're in the process right now of updating that section of our website to break it down by not only gender but also the age, so people can see. With, of course, it comes with a big caveat. That's only with the people who've been tested, and everything that we all hear, whether Rich, Michelle, is that there's not enough testing, and we know that if we have 100 cases in the city, we've got 40,000 people. There's far more than that. And when we have the test done, you'll see that's not only true in Woburn but everywhere in the country. There's just not enough testing.
Yeah, I think that, thank you. And that's an important thing for us to remember. Thank you for the updates. And for those who do want to track it on a more sort of real-time day-to-day basis, that data is available. I've been checking in with it regularly, which I find helpful to just understand where we're at. One of the things that we're dealing with today, of course, is very, very high winds. There's nothing we can do about it. Mother Nature has decided that we're going to have a spring storm. I've seen some trees down. I haven't quite yet heard about power outages, but I've seen certainly fluctuations in my own home. Is there anything that we should know, or is the city prepared for what might be inevitable power outages that come as a result of this storm?
Well, Eversource has contacted us, and they've updated. They've got their emergency portal system up. We've seen quite a few trees down throughout the city with on a lot of private property, which we've seen some major damage on some houses, and then a few on the streets where we've cleaned up. The latest report I got from the DPW is that they're hoping the winds die down sometime around 7 or 8. So far we've handled it pretty well, and it's going well. Not any major power outages in the city. We had one earlier. I think there was an issue where one of the cars hit one of the traffic lights. So we haven't seen too much yet. We'll knock on wood, and this is something that in this time, this is an easy one for us to handle.
Yeah, well, thank you for that, and we're glad that the DPW and teams are out there to help protect us in a situation where power outages sometimes aren't a big deal. It's not winter, so you might be chilly, but we're probably not worried about freezing temperatures. But normally people might go somewhere, go to a coffee shop to work, or go over to a friend's. We don't have the benefit of doing that safely today. So if you are in a situation where you have power outages and you need help, make sure to reach out to your local associations and the people who can help. Is there any
Start
place
with
in
the police
particular?
department, Samantha. Yeah,
Perfect.
they
Thank
start
you.
with the police department. Call the
Thank you.
non-emergency line, and they'll route the call right into Eversource and make sure that they
Perfect.
put that on their list.
Perfect. Thank you. That's
You're
very
welcome.
helpful. Excellent. I'm going to come back to you in a minute, Scott, and cover off on a couple more things.
Sure.
Michelle, welcome and thank you. I've got a couple questions specifically for you. And one of the things that I know you have been with Rich and your other counterparts and have been thinking about, how do we help businesses survive through the situation, but also how do we prepare them to be ready for recovery when things go back to at least some semblance of normal. I know that you did an event, I believe, with the Woburn Business Association, which was great, and I heard good things about. Are there a couple of important things that you talked about there that we can share with our audience here?
Thank you for the question. That's one of the most important things we're all trying to approach these days, is how do we help our small businesses stay afloat and sustain themselves. So we're pleased that the Federal CARES Act had some significant resources in it, and those resources are now starting to be felt locally. So there's the payroll protection program is the biggest one that is really going to benefit small business employers. And those loans are accessible through the Small Business Administration and through your local bank. So you need to find a bank that actually participates in the Small Business Administration's programs in order to apply for those loans. But there's a number of different websites that the SBA is hosting to help you find a local bank and to be able to connect you. Most businesses will have a relationship ongoing with the bank that they're working with. But that's an important piece because it covers approximately 2.5 months worth of payroll, essentially, for companies, along with mortgage costs and utilities and some other expenses that businesses have in their operating budgets. And it'll cover that for a significant loan that will be completely forgiven if you maintain your payroll through June. So that's a really important program. They say it takes a couple hours to submit your application or to go through the entire application process. But the best advice we have right now is to contact your local bank to begin that process if you haven't already. There's several other programs too. People are hearing about the economic injury disaster loans, the EIDLs. Those are also have a grant component, but that's sort of smaller money available up front, and then larger loans of different sizes that you can apply for. So that's another program that's worth exploring.
Great, thank you. Those are very hopeful things that I know a lot of businesses are taking advantage of. One of the things that a couple of folks have asked me about is Chapter 70. So we had hoped and planned to get some additional influx of money to support education and rollout. Does any of what has been happening here, I shouldn't say does it, how much has it disrupted the planned implementation of that and the work that needs to happen so that that money can in fact funnel to cities like Woburn?
So that is really an open question. Last week, we were supposed to have a session with the Ways and Means chairs to look at the changes in revenue anticipated since the COVID crisis. And they had to postpone that session to tomorrow, actually, which is when we're going to get our briefing. But we are expecting, significant impact to state budgets. And that will impact our local aid and our Chapter 70 amounts. And we haven't begun the budget process this year in the same way we normally would have already been well underway. We have begun the initial steps based on the old reality, but now we're racing to try to understand how much sales tax might have fallen off, how much income tax might have fallen off, what are the changes in the revenue expectations, and that's going to take us a while to sort out.
Thank you. Rich, I got a couple questions for you. So one of the folks who made, I think, a fair observation was that some businesses that are deemed essential to stay open seem maybe not as essential as others. And there's a question on the table about how are essential businesses defined. And I'll give you the particular example they gave you, right? An ice cream shop can be open. A liquor store can be open, but a smoke shop that sells tobacco products, which, many would argue are needed. I have a husband who smokes. I can guarantee you he certainly needs his. Now we happen to have many places that we can get those products, but I don't want you to comment specifically on, the tobacco stores necessarily, but it would be helpful to understand the process the state has gone through to define essential businesses, and just make sure we help educate our community on that.
Sure. So the short answer is I don't know specifically, but I can tell you that, I know that, the governor's team, under his authority, once he granted a state of emergency in the Commonwealth, gave him the authority to make those types of determinations. And I think that they were, it's my opinion, but I think that they were trying to work through that a little bit. And, one of the things that they did was they provided an opportunity for businesses to be able to communicate back to the administration and offer information about why their services should be deemed, necessary. So I think that there was a process there for folks to be able to give some feedback. And I think that was probably a good thing. So I know that a lot of people have reached out to my office saying, hey, look, here's why I'm critical. Here's why this is really important. And they've received feedback from the administration, letting them know in some cases that they've updated and changed the criteria. In other cases, they've kind of held the line. You can understand from a public health standpoint of view, we're trying as best we can to keep people at home, to limit people's opportunity to go outside. If you're going outside, covering up. All those things are just critical, particularly in the coming weeks here, to make sure we flatten that curve. So, we're trying to strike a balance. I think that the administration's done a good job on that front.
Yeah, thank you. And look, hey, this is not easy, and there will be exceptions to everything, right? It's impossible to determine the nuance of everything when we're trying to move so quickly. And so I think most of us understand that. It's helpful to understand what the process was, and that there is an opportunity to provide feedback for some folks who may feel that some of those decisions didn't make sense to them. So we appreciate that. We did have some good news, I believe. I think most people at least would consider this good news, Rich, around MCAS and some of the decisions that were there. Can you talk a little bit about that?
So Commissioner Riley weighed in that we received the official waiver from the feds. I think it was Friday. It was either Thursday or Friday, after the House and Senate had both weighed in to the commissioner, indicating that it was our wish that MCAS and grades 3 through 10 be suspended. So that, there was kind of a first step taken by the House and the Senate, which was a good thing. And then the federal waiver was granted as well, because it's a two-part component to actually do that. So we were pleased to get that waiver from the feds. We're pleased to send a clear message, to teachers, to students, to parents, to administrators, to let them know that, if the students are fortunate to be able to come back this school year, that they'll be able to concentrate on learning, on being healthy, on all of those things, as opposed to simply preparing for a test. So I think it was a good news across the board. And they're continuing to revisit other requirements, I think, in the coming days and weeks, associated with other testing mechanisms and graduation requirements and whatnot. I think Commissioner Riley is he's meeting with the superintendents tomorrow to have that conversation. I'm meeting with the education committee, I think, on Wednesday, to have a more robust conversation on that as well. I think we're all going to dig in on when and if the kids are going to be able to go back to school, and try to understand, where superintendents are, where municipal officials are, where teachers are on that issue, and continue to try to take it as a day-by-day approach.
Thank you. And Michelle, thank you for sending over a link. We'll get that posted in the video that publishes. She provided a link to the form that Rich was talking about. So if someone feels that they have important information to share back with us about essential businesses, please feel free to use that mechanism to communicate that out. Rich, I'm going to start with you, but I'm probably going to ask our other guests might have an opinion about this as well. There is two kinds of testing that happens in a scenario like this. There's testing to say, do I have COVID-19 or don't I? And there's testing that is probably much less common, which is around antibodies. And those antibodies would tell us, did I have it, or do I have some kind of potential immunity? I hate to use that word because that's probably too strong a definition, but do I have some protection against this illness built into my system? And there's been a lot of people who have speculated and spoken, if we could do more aggressive antibody testings, it may get us back in some semblance of normal sooner, because some portion of the population who is not aware they were ever sick or were sick in a way that, weren't tested positive or even taken the test. Is there discussion at the state level to make those tests more available in general?
I haven't heard them, to be candid. I mean, I know there's a lot of public discussion going on out there on this. And, I think people are really concentrated right now on trying to get through the next couple of weeks. I think we all know what's going to happen in the next couple of weeks. We understand it's going to be a substantial rise in fatalities, a substantial rise in the number of confirmed cases. All of those things are going to take place. And we want to make sure that our medical professionals have the tools they need to provide the care to the people who are currently sick. Going on, moving forward in the coming, days, weeks, months, et cetera, we're probably going to have more of those types of discussions about whether or not we should be testing more folks. I think long term, the better data we have, the better decisions we're going to be able to make. There's no doubt about that. But we want to make sure, at least in the short term, that we're concentrated on taking care of the folks who are currently inflicted.
Great, thank you. Scott, I do have a couple of questions for you. So over the last few days, we've had a couple of very big celebrations for not all of our population, but for a big portion around Easter and Passover, both happening. And one of the things that's been very hard for us is to sort of honor the stay at home during these what are typically big celebrations. What are some of the ways you saw people sort of celebrating in a appropriate way that protected all of us? Just curious if you saw some things worth calling out.
Well, I think it's like you had mentioned, Samantha, that most people were staying home, over the holidays, celebrating with their families, and it was probably difficult for a lot of the larger families who typically get together with big crowds and particularly on Easter Sunday and celebrate, which is great holiday for most Christians and all Christians. And I think it was a big sacrifice for everybody to not to hold back. I heard from families who drove by, whether it be their mothers or grandmothers, and drove by with parades. And it's difficult. It's difficult for parents to not to be with their grandchildren. I think that was the hardest part that I saw. For a lot of people, I'm sure. Rich, Michelle, you might have seen the same thing, but, people still have, on Easter Sunday, they have great hope, great faith. And it's one of those things that, the services, every denomination is doing some type of service online, which is a great way to adapt to these changing times. And that Easter Sunday Mass means a lot to people. So much to people, and it was great to see that it was being broadcast, like I said, at all cities, towns, and across the state and across the country. So I think that's how people were getting by, and again, continuing to make those sacrifices that we need to make, and we have been making to flatten the curve. And it's working, and not to jump topics, but you keep talking about testing, which is really important, because we do need to start, not get ahead of ourselves, but we really do need to start looking to what are we going to be doing in May to get back to some type of normalcy. And I'm not saying that, the date's May 4th, but sometime we do have to start looking at how are we going to, start adjusting and getting people back to work and, getting out there. There's some great articles in the Globe this weekend. I don't know if anybody read in the ideas section. There was a really, insightful article about the herd and all that. I think if anybody has seen it, we can talk about it. But we're in some really unsettled areas, and we're all working through this together. And the first phase, I think, which we've been doing, and we're doing a really good job, is getting people to understand the importance of social distancing, so that hospitals wouldn't get crushed, and we could take this time to build up our medical equipment, the ventilators. Every big corporation has changed their operations to work under the Wars Act to build these things that we need to stockpile. So when we do have another instance like this, or if we have another outbreak in the fall, we're going to be ready to handle it.
Yeah, thank you. I think that's really important. And Michelle, I don't know if you'll have a thought on sort of building on what Scott said. One of the things that I know I've been paying close attention to is not just the need for the physical equipment around ventilators and such, but also some medications that have started to be in shorter supply. I don't think there's been a dire situation, but for people who maybe need routine asthmatic medications, or I've read an article recently, there was some risk of sedation medications that are used when you're on a ventilator, not being as available as hospitals and healthcare centers would hope. What are some of the things the state's doing to monitor that situation and address it?
So one of the things I was pretty encouraged by was a release that the governor made today about putting $10 million out into the manufacturing sector, specifically to help Massachusetts manufacturers pivot the type of things that they're currently building and be either working in the PPE arena, developing the protective equipment that we need, and then potentially even in the, I'm hoping this will extend to the biotech sector, since we are so strong in Massachusetts on biotech. It's certainly something we're all very aware of, and the private sector has been stepping up in a big way, and you're seeing teams of organizations actually collaborating and breaking down barriers where normally there would be professional competition. And they're actually instead choosing to open source things and share information. And I think that's extremely exciting and very hopeful, both for the long-term prospects of how we respond to this crisis and how rapidly we're able to ramp up with the medications we need, but also long-term for the health of our manufacturing sector here in Massachusetts. So it is an issue for sure, the medications. But what I see is the major pharmaceutical companies stepping up and doing what they need to be doing. And everyone seems to have an awareness of staying in their lane and doing what they do best, but then also sharing that so that others can also build upon their successes.
Yeah, thank you for sharing that. Thank you all very much for joining me today. This has been a great and helpful update for all of us. Is there anything, Michelle, that you'd like to add before we go? And Rich and Scott, I'll ask you the same thing.
You know, it's hard to even come up with words of what to say these days in this crisis. Things are changing so rapidly, and information where, you know, each day we get our briefings and the next day we're completely out of date. And I guess the thing I would say is to encourage people not to get frustrated, to try to find their silver lining and look at this as an incredible opportunity to spend more time with family, perhaps get more organized around the house, take a deep breath, really consider what is the most important thing, and that's got to be, you know, our families, our communities, and supporting one another through this crisis. And if we try to maintain that hopeful outlook, I think it will make everybody just a little bit healthier and make things work a little bit more smoothly.
Yeah, thank you for saying that. I also know that there's been a plea, might be too strong a word, but the food pantry is being heavily used right now in Woburn. And I know, I think, Scott, you shared earlier today, as well as other places, a call for specific items or monetary donations to support that. Anything else, Scott, that you want to add related to that, or anything else before we go?
Yeah, real quickly, I think that's a good point, that the social concern in the food pantry is they're running low, and we put a list of items that they had asked us to share. Not only that, but the monetary contributions. If you're looking to make a donation, that's a great place to do it. And you know, I just want to follow up a little bit on what Michelle said. That it is a great time to connect more with your family, and you know, this does give us the opportunity to do that. But I do also want to make sure that I again recognize that all the sacrifices that we appreciate, all the sacrifices our residents are making. It's a tough time. And a lot of this is, you know, it's all been brought on, you know, not by choice, by any residents, but they're stepping up, making big sacrifices, taking hits to their checkbooks and, you know, their bank accounts, which is really tough. But the people that are out there, we really want to thank, again, the doctors, the nurses, all the medical providers, the police, the fire. I keep saying all the employees who work in the city of Woburn have been fantastic. They go about doing their work, and I keep saying they're running city government. We're not missing a beat. You know, they're doing it with less staff because we have, you know, done some rotating, but everybody's coming in, they're stepping up and making a big difference. So those are the people that, you know, I really want to thank for their commitment during this whole crisis. And things are going to get better. You know, it's coming. There's going to be brighter days coming. We just got to keep moving forward confidently and without fear, because it's going to be a good time.
Thank you.
Okay.
Rich, anything that you'd like to add before we go?
Yeah, I would just echo the mayor's sentiments and the representative sentiments that, our community and like so many other communities across the Commonwealth continues to deal with it in our own way. And we're doing everything right. We're making sure that we're staying home and, social distancing and respecting kind of what we're all going through together in order to protect our friends, our neighbors, our family members, all of those things. And we know a lot of people who've been impacted by this. And some folks may not be touched by it personally, but they know somebody down the road who may be, and they're doing their real best, I think, to try to help in their own way. And we've seen that time and time again, I think, across our city and across the whole state. So we're really fortunate, I think, the way we've responded right now. We've got to stay the course over the course of the coming days and weeks to make sure that we get through this. We have to recognize that staying apart at this time is the most important thing we can do to get out of this in the shortest period of time possible. And we're grateful, I think, for everybody's cooperation during these challenging times.
Well, thank you to all of my guests today. Every week I think, I'm not sure we're going to have anything new to talk about this week on this topic, and every week we do, and we have important things to talk about. So thank you for continuing to share updates and insights as they're changing. I think Michelle mentioned earlier, on a daily and sometimes hourly basis, keeping each other informed, and the staff at Woburn Public Media that continues to help us communicate things, but also do things like show church services online and other things are an incredible asset to our community. So, and thank you, of course, to all of our listeners and audience who have joined us today. Please stay safe and take care of each other.
Thanks, Samantha.